An episiotomy is a surgical cut made in the perineum, the area of skin between the vagina and the anus during childbirth. This procedure is typically performed by an obstetrician or a midwife to assist in the delivery process. The perineum is a sensitive area that can stretch significantly during childbirth, but sometimes a surgical cut is deemed necessary to prevent severe tearing or to expedite the delivery, especially in cases of fetal distress. This procedure is performed to widen the vaginal opening and facilitate the delivery of the baby. By making a precise incision, the healthcare provider can help create more space for the baby to pass through, potentially reducing the risk of uncontrolled tearing, which can be more difficult to repair and may lead to longer recovery times for the mother. Episiotomies were once considered a routine part of childbirth, but their use has become less common in recent years. Advances in medical knowledge and changes in childbirth practices have led to a more conservative approach. Today, healthcare providers are more likely to allow the perineum to tear naturally if it happens, rather than performing an episiotomy as a standard procedure. There are different types of episiotomy incisions, including midline and mediolateral. A midline incision is made vertically, while a mediolateral incision is made at an angle. Each type has its own set of advantages and potential complications. For instance, midline incisions are easier to repair but may extend into the anal area, whereas mediolateral incisions are less likely to extend but can be more painful and take longer to heal. The choice of incision depends on various factors, including the position of the baby and the mother's anatomy. Other considerations may include the urgency of the delivery, the baby's size, and the elasticity of the mother's perineal tissues. The healthcare provider will assess these factors to determine the most appropriate type of incision if an episiotomy is deemed necessary. It's important to remember that every birth is unique, and the decision to perform an episiotomy is made on a case-by-case basis. Open communication between the expectant mother and her healthcare team is crucial. Discussing the potential need for an episiotomy, along with its risks and benefits, can help ensure that the mother feels informed and prepared for her childbirth experience. Ultimately, the goal is to ensure the safety and well-being of both the mother and the baby. While no longer routine, there are certain situations during labor and delivery where an episiotomy might be considered necessary. This surgical incision made in the perineum, the area between the vaginal opening and the anus, can sometimes be the best option to ensure the safety of both mother and baby. One such instance is if the baby's heart rate indicates distress, requiring a faster delivery. Fetal distress can be a sign that the baby is not getting enough oxygen, and a quick delivery becomes paramount to prevent complications. Another is if the baby is in an unusual position that makes a vaginal delivery difficult. For example, a breech position, where the baby is positioned feet first, can complicate the delivery process and may necessitate an episiotomy to facilitate a safer birth. Sometimes an episiotomy might be considered if the mother is experiencing a prolonged pushing stage, and a larger vaginal opening could help expedite the delivery. Prolonged labor can be exhausting for the mother and may increase the risk of complications for both mother and baby. It's crucial for medical professionals to carefully weigh the potential benefits against the risks before making a decision. They must consider factors such as the baby's size, the mother's health, and the progress of labor. The goal is always to ensure the safest possible outcome for both mother and child, making the decision to perform an episiotomy a carefully considered one. Like any surgical procedure, episiotomies carry potential risks and complications. These can include infection, bleeding, pain, and discomfort during healing. Some women may experience pain during intercourse after an episiotomy. Long-term complications, though less common, can include urinary or fecal incontinence. It's important for women to be aware of these risks and to discuss them with their healthcare provider. Following an episiotomy, proper care is essential for healing and to minimize discomfort. Pain management is usually provided, often with over-the-counter pain relievers or, in some cases, prescription medication. Keeping the area clean and dry is crucial to prevent infection. Warm sitz baths can also provide relief and promote healing. Full recovery from an episiotomy can take several weeks. Before performing an episiotomy, healthcare providers should obtain informed consent from the mother. This means thoroughly explaining the procedure, its potential benefits, and any associated risks. Women have the right to ask questions and to decline the procedure if they prefer. Open communication between the woman and her medical team is essential throughout the birthing process. For expecting parents, it's natural to have questions about labor, delivery, and potential interventions like episiotomies. Don't hesitate to discuss your concerns with your doctor or midwife. They can provide you with accurate information and address any anxieties you may have. Additionally, many resources are available online and through community organizations that offer support and education about childbirth. While episiotomies can be medically necessary in certain situations, they're often overused. An episiotomy is a surgical cut made at the opening of the vagina during childbirth, intended to aid a difficult delivery and prevent rupture of tissues. However, this procedure can sometimes lead to complications, such as infection or extended recovery time. There's a growing emphasis on reducing unnecessary interventions during childbirth. Many healthcare providers are now focusing on more natural methods to support the birthing process. This shift aims to empower women to have more control over their birthing experience and to promote better outcomes for both mother and baby. Prenatal perineal massage has been shown to help prepare the tissues for childbirth. This technique involves gently massaging the perineum, the area between the vagina and the anus, to increase its elasticity. Regular practice of perineal massage in the weeks leading up to delivery can make a significant difference and potentially reduce the need for an episiotomy. By preparing the perineal tissues, the likelihood of tearing during childbirth can be minimized, leading to a more comfortable and quicker recovery for the mother. Other practices, such as warm compresses applied during labor, can also be beneficial. Warm compresses help to relax the perineal tissues and increase blood flow, which can reduce pain and the risk of tearing. Controlled pushing techniques, where the mother is guided to push in a more measured and effective manner, can also help minimize the risk of tearing. These techniques often involve breathing exercises and specific positions that support the natural birthing process. Ultimately, the goal is to support safe and healthy births for both mothers and babies. By adopting these practices, we can create a more positive birthing experience, reduce the need for medical interventions, and promote the well-being of both mother and child.